Welcome everyone. Thank you for joining us today. I'm Teresa Marantat, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 149,094 confirmed cases of COVID-19 in Canada and 48,496 cases in Ontario. Chatham-Kent has 366 cases, and Sarnia-Lambton has reported 344 cases. Michigan now has 119,597 cases, with 14,314 cases being in Detroit. Today, we are reporting a total of 2,644 cases of COVID-19 since March, an increase of 5 cases from yesterday. 1 is a worker in the agri-farm sector. 1 is a local healthcare worker. 2 are close contacts of confirmed cases, and 1 is still being investigated by our nurses. 2,492 cases are resolved, and 76 cases are considered active and being followed by our health unit. 3 people are in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There is currently 1 retirement home experiencing a COVID-19 outbreak. With return to school, parents are reminded to conduct daily symptom checks before sending their child to school. Parents are encouraged to use the ministry's assessment tool, which can be accessed through our website or ontario.ca. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, and diarrhea. New provincial guidelines on testing state low-risk, asymptomatic individuals should not be considered for testing. For people with at least 1 symptom of COVID, they should consider testing. Windsor-Essex has 3 assessment and testing centres, including the St. Clair College Sportsplex, Windsor Regional Hospital Olette Campus, and Erie Shores Healthcare in Leamington, as well as SOHAC in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must stay home and remain isolated pending your test result. The health unit will call you if you have tested positive for COVID-19. Due to quick access online, you may receive your results before the health unit contacts you. Please continue to visit our website at wechu.org for further information. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, everyone, and thank you for joining us today for our weekly epidemiological summary. Are we good, Mark? Okay, so this is what we will cover, no different than what we have been covering, providing the most up-to-date epidemiological summary and many of these data we presented before with some addition of new data today. The epi curve help us assess the progression of the disease, whether we're in the community or in an outbreak situation. And this particular epi curve is created to show the number of confirmed cases by the date it was reported to public health. On your vertical axis, you have the number of confirmed cases, and on your horizontal axis, you have the date that these cases are reported to public health. This includes all the cases in the community, cases in the long-term care home and retirement home. As you can see that we have seen significant variation in terms of the case counts going all the way up to close to 100 cases a day in sometime mid-June, but more recently we are seeing a trend moving in the downward direction. So zooming specifically on the last couple of months from August and September, this is what the trend looks like. Since August, we just had 9 days when we reported more double digits cases. Other than that, most of the days we've reported a single digit case in Windsor-Essex since August of this year. In order to capture the day-to-day variation, another way to look at that is to look at the 3-day moving average. So this doesn't look very much different, but what we can see and appreciate more recently in the last couple of months, the number of cases are pretty much steady, and with some peaks and valleys, but generally below where we are, where we were before in June and July. Zooming it further again, just for the month of August and September, this is what it looks like. Roughly, we are seeing 5 cases a day based on a 3-day moving average. Starting all the way from August, we've seen some cases, but then declining significantly in the month of September. Looking at the cumulative case counts and deaths since the first case was reported in Windsor-Essex, new cases have remained relatively low in the past month and leading to a general stabilization of COVID-19 in Windsor-Essex. The way to interpret this graph is to look at the steepness of the curve. Steep curves mean too many cases in a short period of time, and a flat curve means less cases over time. So what we can see is we have seen lots of steepness in June and some in July, but more recently in August and September, we are seeing the flattening of the curve, and this is essentially showing that the number of cases that are being reported day to day is relatively low, giving that flatness to the curve. Looking at the 7-day moving average, the blue line is there to indicate all of our cases using a 7-day moving average. We see a peak in late March and in April, the latter attributed to the outbreaks in long-term care and home and retirement home. In the past month or so, our 7-day moving averages remain low due to the low to known cases in the agri-farm sector. This green line looks at the 7-day moving average if we were to remove the workers in the agri-farm sector, but now as we can see, the blue line is almost merged with the green line, which essentially is showing that there are no to very few cases in the agri-farm sector, and then basically those two curves are combined together now. This slide captures the week-over-week incidence rate per 100,000 population from week 18, which is April 27, to our current week, which is week 39. We see a dramatic increase in cases in week 26 and a second peak in week 30th, which are primarily attributed to the agri-farm sector. We are seeing a continued decrease as of week 39. Please note that week 39 is still in progress and it ends on Sunday. Comparing our week-over-week cases with the Southwest region as well as the province of Ontario, what we can see is our weekly case rate of COVID remained higher than the provincial average and even higher than the Southwestern region average. But right now what we are seeing is we are in the last at least 2-3 weeks, weekly case rates is below the provincial average, where the provincial average is case rate is increasing. R is very much stabilized, and similar trend we are seeing in the Southwest region as well. So this particular figure looks at all the tests and unique individuals tested by week in Windsor. In total, roughly 99,397 tests were completed, or you can say close to 100,000 tests were completed. Among those, close to a little over 60,000 individuals were tested as of September 19. Looking at all our tests, our current person positivity is 0.8%, which is represented in the green line, and our cumulative person positivity since the beginning of this pandemic is 2.8%. Last week, approximately 700 tests were completed daily, and our overall person positivity since the beginning of this pandemic is 2.9%. So this is a new graph that we added, and it looks at the percentage of test results, all test results that are available within 1 day of someone getting tested using a 7-day average. Recently, from September 10th onward, we saw a sharp decline in the 1-day turnaround time for the labs for test results, and these are all test results which is either positive or negative. And what we can see is in the beginning there was less cases that were reported within the 1-day turnaround time, but overall that got better, and more recently we are seeing some delay in getting the test results back. Comparing our COVID rates with the region and the province overall, this is the cumulative rates, has the highest. Windsor-Essex continues to has the highest rate in the province, and locally they've experienced higher proportion of cases in the long-term care home as well as in the agri-farm sector, and we all are aware that Windsor-Essex is home to large number of farms, which has contributed to the increase that we have seen in our region. Looking at case rates by each of these municipalities, Kingsville and Leamington had the highest case rates, and all of those case rates are attributed to or majority of those case rates are attributed to the agri-farm sector, whereas the rest of the municipalities are relatively similar number of case rates in the region. Mapping confirmed COVID-19 cases in Windsor-Essex, this is what it looks like, and this map displays the rate per 1,000 resident by the dissemination areas. The areas with no colors are places where there haven't been any lab-confirmed cases of COVID, for example, tested and diagnosed. The scale that is being used in this particular graph is range from 0.5 cases per 1,000 to 368.2 cases per 1,000. The scale will change in each map and is a relative comparison to the cases in each geographical distribution. As you can tell from the previous slide, in Leamington and Kingsville, the darker colors indicate higher cases in those specific dissemination areas. Relative to the county, rates are low in the city of Windsor. Yellow or lighter version of yellow indicates low rates of COVID in these areas. And one thing to note is, please note that these are the cases where individuals live and not necessarily where these individuals acquired the infection. Cases may have been exposed in COVID outside of their home in any other jurisdiction, and then they are isolating in these locations, and that's where these residential addresses are coming from. Zooming in on the city of Windsor, this map looks at the rate again for 1,000 resident. The areas where there is no color are areas where there is no lab confirmed case. This particular map shows the case scale from 0.8 cases per 1,000 to 47 cases per 1,000. This map looks at the cases that are currently active from the health unit perspective, and the active cases are attributed to pockets across Windsor-Essex, but overall what we can see is there's generally low rates across the region. Zooming in on the city of Windsor, this is what it looks like. Our rates are, again, relatively low compared to the county, but within the city of Windsor, among the active cases, rates are higher in certain pockets, and more specifically, it's in the southwest, South Windsor area that we have seen the cases right now. Looking at the age and sex distribution of cases in the region, we have seen some changes in terms of the age and sex distribution of cases overall throughout the pandemic. So this particular graph compares to overall, the green bars indicate the overall age and sex distribution, whereas the blue bar just focus on the last 2 weeks. And as you can see, the green bar is relatively stable with more males infected than the females. But in the last 2 weeks, as you can see, the cases in the younger people between the ages of 0 to 29 is increased, with a significant increase in the age range of between 20 to 29. This graph looks at the overall cases in Windsor-Essex by each of the municipality. Overall, 34% of our cases have been from Leamington, 34% from Windsor, and 22% from Kingsville, and the rest of the municipality had a relatively lower number of cases overall. Zooming in on the last 30 days, this is what it looks like. Similar picture, Windsor bearing the most of the cases, 58%, while the other areas of where these cases came from are Leamington and some from LaSalle as well, where the rest of the region showed minimal flu activity in the last 30 days. Zooming further on the last 7 days, similar picture with Windsor, Leamington, Kingsville sharing the burden, most of the burden of the cases, with LaSalle, Lakeshore relatively stable, and Essex and Amherstburg no cases at all. So this graph shows the epi curve by reported date for the city of Windsor with many cases. This shows a nice picture of what happened with some ups and downs, significant activity in the month of July, and with some increase in the month of August, but right now it's trending downwards. This is what it looks like in Amherstburg with low number of cases. There's not much activity we can appreciate in this graph, but it just gives you an indication of the confirmed cases in the town of Amherstburg. Town of Essex, this is what it looks like with some activities in the month of July, with some, and right now it's trending downwards with very limited cases. Kingsville have seen, again, a large number of cases in the region, but most of these cases, as we can see in this graph, is the activity was in the month of June and July, while it's more recently it's been trending down with some increase in the last few weeks, but overall the trend is moving in the right direction. Similar picture in Leamington with majority of the activity happening in the month of June and mid of July, which is now again flattening and going down in the right direction. Town of Lakeshore, similar picture with not many cases. This is what it looks like. Not much to appreciate because of low numbers, but overall the numbers and the rates, the moving average, they're all much lower and moving in the right direction. Similar picture in LaSalle, a spike late in the month of August, but now trending downwards with limited cases. Similar trend in Tecumseh with some spike in the late August, early September, but now trending downwards with low cases. So here we are looking at how our cases acquired COVID in the last couple of months only. We did talk about the overall picture, but this just focused on the month of August and September. While the majority of the cases that we are seeing in our community is a result of close contact, we are also seeing some community transmission happening and occasional travel-related cases. Most of these travel-related cases are in the agri-farm sector, and they are testing positive during their quarantine period when they are arriving. This particular graph shows the number of COVID hospitalization and patients in ICU on a given day, and it includes both new patient and existing patient with COVID-19. Cases in the ICU have remained low for a while. In the past 2 weeks, this number has been 0. The red line indicates the 7-day moving average in the ICU, showing a decrease to 0 as well in the last 7 days. Hospitalization have fluctuated more so than the ICU. While we have seen a surge in late August, we're seeing a sharp decline in the number of cases currently in the hospitalized, and this is also reflected in the orange line. Looking at the overall health system capacity, not just for COVID, but overall, what we are looking at the orange line, which is highlighting the occupancy rate of our acute care bed. The threshold is to have the occupancy rate be below 85%, which we are just meeting. This signals that we may not be able to meet the demands related to COVID and could be stretched if capacity is not increased. What is of concern is the green and blue line, what we can see from the ICU capacity and ICU ventilator beds, respectively. We are seeing that the overall capacity, what is aimed to keep it below 50%, but we are above 50%, and there were a time when we were close to 70% of the capacity, which signals that the ICU capacity can be overwhelmed if there's a sudden surge in the need for hospitalization, and if some of these individuals require intensive care in the hospital settings. So this is where are these cases? 94% of our cases that the Windsor-Essex County has seen is resolved, with less than 3%, 2.6% are currently active or self-isolating. Unfortunately, we lost roughly 3% of our cases to COVID. Looking at the age and sex breakdown of those individuals who lost their lives to COVID, overall, more female died with COVID diagnosis compared to male. And from an age distribution perspective, 66% of the deaths were in individual who were 80 years and older. And the youngest person who died in our region was a man in his 20s. This particular graph compares case fatality rate as a result of COVID and comparing the long-term care home with the province, which again, our region case fatality rate was lower than the province. And similarly, the overall Windsor-Essex case fatality rate was lower than the provincial average. So looking at the case doubling time, which is an indicator of how long it's taking for the case counts to double, we have seen significant variation. We have seen many weeks when our case doubling time was lower than the provincial average. But more recently, what we are seeing is we are doing much better compared to the province and the country. Zooming in just on the last couple of months, August and September, our day-over-day doubling time stayed consistently above the provincial and Canadian doubling time, with few occasional dips. And again, a reminder that if your doubling time is higher, that means you're doing better, and that means you have less local cases, and as a result, your case doubling time is increasing. And Windsor-Essex in county is represented in the blue line in this particular graph, where the Canadian average is represented in the red line, and the provincial average or the provincial doubling time is represented in the green line. The most recent estimated mean R naught effective is 0.21. This is a further decrease from last week when the R naught is less than 1. As we've explained before, every infection is causing less than 1 new infection, signaling a decrease in the virus activity in our community. When the R naught is greater than 1, that means each existing infection is causing more than 1 new infection. And our R naught is fluctuated significantly throughout the course of the pandemic. But right now, we are doing better and we are moving in the right direction. And we just want to make sure that we continue to stay in that direction. So in summary, Windsor-Essex, we are seeing low cases overall, and we have presented some of that information by looking at our epi curve, comparing our provincial rates, weekly rates with the province and the rest of the region. The primary source of exposure continues to be a close contact with a confirmed case in our region, but we are still seeing some of the community transmission, and we need to make sure that we are reducing that community transmission as much as possible. COVID-related hospitalization and ICU occupancy is low, but overall as a health system, we are seeing an increased utilization of acute care beds, ICU beds, and primarily due to the reactivation of some of the non-essential surgeries and other hospital services that were ramped down in the middle of the pandemic, but now they are back in providing so many of these care. Day-over-day doubling time in Windsor-Essex is better compared to the province and nationally, and we hope that with the support of the community and the agencies and everyone involved, we will keep that number day-over-day doubling time increase and low number of cases locally. Right now, our R naught effective is 0.21, which is the lowest that we have seen, indicating a decrease in transmission in Windsor-Essex, and we like to keep it that way. So please do your part and make sure that everyone is following the recommendation. It's not the time to be complacent. We have seen what is happening in other regions, and we definitely don't want to be in a position where we need to scale back. So right now, in order to keep everyone going, keep everything going, we just need to continue to do our part. Thank you.
So we'll now take questions from the media.
The conference is now unmuted.
We'll start with AIM 800.
Hi, good morning. Just wondering, as we get closer to Thanksgiving, and the Prime Minister addressed it when he addressed the nation the other night, just saying that, we still have a shot at Christmas. What is your message to people as we head into, the fall festive season?
Well, I think our message is similar to what we've been talking about. So obviously, we need to be mindful that the viruses still exist in our community. We have ongoing cases. We are seeing some of the community transmission. So it's incumbent on us, and it's very important that we take care of ourselves and we take care of our loved ones. So anything that we are doing right now is resulting in the low number of cases at this time. We just need to make sure that we follow those and we continue to do the good work that we have been doing. And all of us are in this together. It's no single person, no single agency can take care of what we are dealing with. So the advice is, obviously there are many opportunities for people to come into close contact with each other. There are business activities going on. So everything that you are doing, please do it properly. Please do it in a safe manner to ensure that you are keeping yourself safe and you're keeping others safe as well.
And after we've had those two major community clusters reported on, we've had single-digit increases over the past few days now. So do you think that people are, again, starting to get the message after we've seen what can happen and how quickly it can happen?
I truly believe so, and I think that's why I keep giving credit back to the community, because without their support, without their help, doesn't matter what I say, doesn't matter what anyone say. The bottom line is we need to act. Everyone need to act, and I think they are doing that part. And we just want to make sure that we continue to do that, and that's the key piece. It's as boring as it sounds, but those are some of the measures that will keep us in the right direction, and we will reduce the number of cases when everyone is doing that. So clearly the numbers are suggesting that people are following those recommendations and they're getting it. We just want to make sure that they continue to do that part.
Okay, thank you.
Any questions from Blackburn?
Just the few agri-farm cases that we've seen in the last couple of days, are they all from the same farm, same facility?
So the cases in the agri-farms are in separate cases in each farm. So we have, I think over the last few days, we've had 4 cases, and they're all at individual farms. So 4 cases, 4 farms.
Okay, thank you. And any evidence to this point of transmission in any of the school cases that have been identified?
No transmission related to the schools that have had cases.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Dr. Ahmed. I'm just wondering if you support the province's decision to tell people who are asymptomatic and low risk that they shouldn't be seeking a COVID-19 test.
Well, I think it really depends on the capacity of the system. We are living in Canada, which is a publicly funded healthcare system with limited resources. The resources should be directed to those who need care, and we have to be very careful in how we are spending those dollars. So as much as I like to see the options and opportunities for people to get the care that they need, we should not lose focus on the people who actually should be tested. What we have seen more recently is a delay in getting the test results back, and people without having any high-risk exposures, people without having any symptoms. And if they are the one, and if that's where the resources are going in, so I think it's critical for us to take a step back and see how do we allocate these scarce resources that we have. There's no such thing as unlimited resources, so there's always some limitation. We just need to be smart, we just need to be careful about it. And as the system allows those options for people to get tested despite having any exposure or despite having any symptoms, it's nice to have, but I think the focus right now are the system should have the ability to test people who need testing and make sure that appropriate action is taken.
Is it then reasonable to believe that our percentage of positive tests coming back will go up, considering fewer people who don't necessarily need a test will be getting those tests?
That's really a good observation, Taylor, because then what we are saying is when we are talking about you have to look at the pre-test probability. So this is the likelihood that we are assessing that if someone who doesn't have anything, what's their likelihood that they will come back positive? So anyone without any symptom, without any exposure, their pre-test probability is very low. And then in those type of situations, you would expect that when we are talking about the person positivity, it would be low. But let's say if you increase the pretest probability, which means basically someone either with an exposure or with a symptom, the likelihood of them coming back positive would be high. And if only those individuals are tested, your person positivity would increase. So that's the real correlation that you can see, and we can expect to see that. So that's a good observation.
Thank you.
Any questions from CBC?
Yes, good morning, Dr. Ahmed. I just had a question. I mean, obviously testing guidelines are changing, but, if someone tests positive for COVID and they are quarantining with their family and they wait the 14 days, they don't have any symptoms, is it recommended that the family or, because they would be close contacts with that person, is it recommended that the family get tested?
At this point, it's not the indication, and the recommendation is there that if you have the high risk exposure, then you said that, and so I don't know if maybe I'll let Teresa say that maybe there's some wording changes in the guidance that Teresa is looking at. So over to Teresa.
So the new guidance is saying that low-risk asymptomatic people should not get tested, but the guidance also indicates that those that are, asymptomatic, but if they are a case of a contact of a confirmed case, that puts them at a higher risk. So in that case, if they are asymptomatic, testing can occur, but it's after 5 to 7 days or after 10 days. So, and that's the approach we have even with the schools right now. So it's the high risk contacts. So that is included in the current guidelines that, the risk changes. So the guidelines changed for low risk asymptomatic people, but high risk close contacts basically remains the same for testing.
Because I spoke with one family who did have a child who tested positive for COVID, and they said that it was recommended that the other family members not get tested. Now, this would have been before the provincial changes. Is that true? Would that have been public health recommendations for families?
So I think it really depends. I not knowing the case directly, I think it would be hard for us to say. But generally speaking, let's say if, and again, it goes back to the whole idea of when are you asking them to get tested and what kind of symptoms they have. Because let's say if someone got positive today, and if you're asking for the rest of the family member to get tested today, the likelihood of anyone as a result of family transmission would be very low. So you have to wait for a certain number of days before you can even advise them for tested. But then again, having said that, on the same situation, if a young child is infected, someone would question that how this child acquired the disease. Because if the child does not have any other exposure, the likely exposure could be from the family. So we would recommend in that situation that yes, the family should get tested immediately, because that's what it means, that maybe someone else in the family is sick and maybe passed it on, the virus to the individual. So without knowing the exact situation, I think it would be hard for us to say, but generally speaking, for adults, if someone is infected, we ask the rest of the individuals to self-isolate. 5 to 7 days after, we can recommend that, you can go for testing so that we know if someone is acquired or if there's any transmission happened or not. If there is no transmission happened, if there is no symptoms, if there is nothing that would indicate that there is any breach of self-isolation, many of these individuals may not even need to get tested. What the testing guidelines, I think, basically is trying to refer to when we are saying that, if you do not have any high-risk exposure, if you are not symptomatic, you don't need to go and get tested. You won't be tested. You have to have some kind of symptoms or a high-risk exposure. So in case of a family, you have a high-risk exposure. So those individuals will be prioritized for testing, and then they can get tested.
Thank you.
Any additional questions from AM 800?
No, thank you. Have a good weekend.
Thank you.
Any additional questions from Blackburn?
No, thank you.
Windsor Star?
No, thank you.
CBC?
No, thank you.
Thank you, everyone.
Thank you.
Thanks.